Hi, I'm Joe Safdieh, Editor-in-Chief of Neurology Today, and I'm here today with Dr. Sarah Pavitt, who's an assistant professor and director of the Pediatric Headache Program at University of Texas, Austin. So, Dr. Pavitt, tell us about your work.
Yeah, thank you so much for having me. We know that sodium valproate is really commonly used to treat status migrainosus in the pediatric and adult population, and the oral form has been used to treat as a preventive medication in the adult population. At our institution, we take those themes and we directly and electively admit pediatric patients with refractory chronic primary headache disorders for a 4-day standardized protocol of sodium valproate. And we pair this with a new preventive 1 week after discharge to really target preventive treatment. This study, we conducted a retrospective chart review of all pediatric patients admitted to UCSF for our sodium valproate protocol from January 2017 to October 2020. We only reviewed first-time admissions to help with selection bias, and we evaluated clinic notes and their hospital admissions specifically to look at specific outcomes of headache frequency, headache severity, and acute medication usage, as well as safety side effects of the medication with these patients. Overall, we identified 45 patients that were included for the review. These patients averaged 15 years old with a range of 9 to 18, and the majority were female, which is the typical demographics that we see in our headache clinic. 87% of these patients had chronic migraine, 11% had new daily persistent headache, and we had 1 patient with persistent post-traumatic headache. 92% of these patients had continuous and daily headache, and on average, they had 7 previous preventive trials fail them. 87% of them didn't respond to previous inpatient infusions. Overall, what we found was significant decreases in baseline headache intensity from 6.8 out of 10 to 5.2 out of 10, and significant decreases in acute medication usage. We did see a decrease in daily in headache frequency, although that was not significant. But I will say that we had 5 of these patients see greater than 50% of headache reduction in regards to frequency. Overall, only 5 patients reported any type of side effects. They were all mild and included nausea, fatigue, and dizziness. We did have 1 patient discontinue the hospitalization early due to anxiety around IV placement and the hospitalization in general, which we deemed was not due to the medication itself. So overall in this study, we found that sodium valproate may be an effective and safe preventive treatment plan for pediatric patients with refractory chronic primary headache disorders.
I think that's really interesting. And, because valproic acid, of course, is already on the market and it's been labeled for migraine for many years, it's presumably possible that some can actually take the findings of your study and even apply it immediately, which is exciting. Do you have any tips or tricks or pointers for neurologists who may treat adult or headache patients or pediatric headache patients who might want to consider using IV valproate in the inpatient setting?
Absolutely. So we had, and you can see it on our abstract, we created a 4-day standardized protocol. All patients are given a 15 milligram per kilogram loading dose and then 12 subsequent 5 milligrams per kilogram doses. These patients typically tolerate this medication very well with limited side effects, but we do give it every 6 hours. So we do it in the inpatient setting. I think one thing to really highlight with this study is we are really looking at the most refractory patients in our headache center that typically have the highest burden of disease. So these patients are classically excluded from clinical trials, and we're hoping that this study provides some evidence and some groundwork for an effective treatment option for these patients.
So I think this is all really great. My next question is really about next steps. So are you guys considering perhaps doing a randomized trial or additional analyses of these patients to this treatment?
Yes, I absolutely recognize the limitations that come along with retrospective reviews, but we're hoping that this can provide the foundation for now prospective studies and potentially randomized controlled trials, even looking and comparing at other inpatient infusions such as DHE. So we're hoping that this provides a foundation for further work to better evaluate the safety and efficacy of this protocol.
Great. Thank you so much. We really appreciate it and look forward to seeing future advances from your research.
Thank you so much.